Hi everyone, this is Dr. Carola Okogbaa with Louisiana Center for Eyes. Thank you for joining me once again today for another Facebook Live. It's always a joy to come on and talk about eye health. And so we're going to call it Eye Health Conversations with Dr. Okogbaa. So I hope you guys like that. If you have any questions about health, eye health, or something you'd like to learn more about or want me to speak on, go ahead and leave it make in the comments, and I will try my best to address it. And so today I want to talk about a question or answer a question that I get a lot from patients. And so one of the questions that I tend to get is, someone may be looking at their eyes or in the mirror, or have noticed that they have a grayish, bluish, like a ring all around 360 degrees around their eye, around the dark part of the eye or the cornea. And the first thought is, is that a cataract? At least that's what they'll ask me. Doc, I have a ring around the eye. Is it a cataract? And so we'll kind of address what that is and then go from there. So when people have this grayish color, ring-like color around the eye, we call it Arcus senilis. That's the medical term for it. But right off the bat, I'll tell you, it doesn't impact the vision. We tend to see it more in older individuals. So as you get older, after middle age, it can start to appear. Sometimes it can make the eye appear to have as if it's changing color. So they're telling me, I think my eye is changing color and I have this ring around my eye, but really that ring is on the cornea, which is the clear covering of the eye. And your eye color is really not changing. It's the reflection that it gives off that makes it appear as if your eye color is changing due to this ring. Okay, so your eye color is not changing. So number two, is that something bad to have? No, it's not. Typically, again, it comes with age, and it has to do with what we call lipid deposit or cholesterol deposits right around the periphery of the cornea. And that's what causes this ring that we call Arcus senilis. It doesn't cause any vision issues. It doesn't cause any problems at all. However, if you are a younger person, let's say you're in your 40s, 50s, and younger, and you have that, it could be a sign of high cholesterol, or it could be family history of having hyperlipidemia or high lipids in your bloodstream. Okay, so high cholesterol would be what we would associate it with it, and then I would send you to see your primary care to do workup to make sure that your cholesterol is not high or to address that. Okay, but typically in older individuals, it's not necessarily tied to having high cholesterol. It could just be due to age. But again, it's always good to get your annual exam, get your blood checked, make sure all of that is good. And so, no, it's not a cataract. The cataract is inside of the eye, is the lens that gets cloudy in our eyes, typically due to age, and that's what we call a cataract. And you cannot see it physically. So you cannot see the cataract yourself unless it's like really, really advanced that you would have to know what you're looking at. So, but I can see it. Sometimes I can see it from across the room, and I'm telling you have a cataract and that may need to be operated on. So no, it's not a cataract. It's a ring. We call that ring Arcus senilis. It doesn't cause any vision problems. It doesn't cause any issues for the eyes, typically seen as we age, as we get older. Okay. And so that's what that is. And so I wanted to come on and answer that. And I also would like to invite you to come in for your eye exam. If you have not had your eye exam for the year 2023, I would love to see you. And if you've missed your eye exam last year or you didn't get a check on your eyes, please make sure you make an appointment. If you happen to be in the Baton Rouge area and you're looking for a wonderful eye doctor, well, give us a call at 225-356-2655 or stop by the office or check us out on our website, www.lacenterforeyes.com, and let us know, and we'll be able to see you and set you up with an appointment. That's all I have for you today. Have a wonderful rest of your day. Thank you. Bye-bye.